Let's discuss in more detail some of the complications that are specific for each operation. And I'd like to start by talking about facelift. Facelift is a very common operation that we do. Generally it's done as an outpatient with a little IV sedation, and many times it's combined with other procedures such as an upper lid blast or coronal, and we'll discuss those individually. But I'd like to focus first on a facelift. What are some of the unique characteristics as far as complications go as it relates to facelift? Again, we go back to what I said earlier about bruising, swelling, infection, bleeding, scarring. There are two areas that I think are important. Is number one, nerve damage. Now in the face we have two types of nerves. We have sensory nerves, which are touch and feel, and then we have motor nerves, which innervate muscles in the face. Now in 35 years I've never had a permanent motor nerve injury, so it's very rare for that to occur. Now, a sensory nerve is a nerve that provides touch and feel. So I tell patients, any time that you have an insult to the skin, you may fall down and cut yourself, you may go ahead and be separating some frozen hamburgers and cut your finger. Anytime you cut skin anywhere in the body, you will disrupt and cut little sensory nerves. Now, generally speaking, other nerves in the area will overtake the sensory function of that nerve that's cut. For example, after the cut you may feel that the skin distal to the cut is kind of numb and tingling. You may get strange sensations like needles and pins, prickly sensation, ants crawling on the skin. These are all signs that the nerves are regenerating, and that's a good thing. Now that regeneration can take weeks, months, who knows. But generally speaking, that's part and parcel of sensory nerve loss following a facelift. Many times patients will come back 10 years later and say, you know what, this earlobe feels different than this earlobe. They look the same, but there's just a little bit difference in terms of feeling. I think one of the more disturbing complications should it occur, and that has to do with skin slough. Now what skin slough is skin slough is an area of skin that doesn't heal because of inadequate blood supply. For example, you may form a big scab in front of the ear. It could occur behind the ear. It's very, very uncommon. Like if we were to do 100 facelifts, you might see it once or twice. But almost routinely, when skin slough does occur, it's in a smoker. So it really, really is imperative to quit smoking at least 2 weeks before the procedure and at least 2 to 3 weeks after the procedure until all the stitches are out and the wounds have healed. Because when people smoke, the vessels constrict, which means we don't get enough blood. And blood is the lifeline to making sure the wounds heal appropriately. So when people smoke, they go ahead, vessels constrict, you don't get blood flow, skin dies, and this can lead to significant scarring that can take weeks and months to heal. So by all means, go ahead and do yourself a favor, do your surgeon a favor, quit smoking at least 2 to 3 weeks before your surgery as well as after the surgery. And I know it's a difficult thing, but I tell all my patients, if you are a smoker, it's very, very difficult for me to be a little more aggressive than I might ordinarily be in a non-smoker. So by all means, quit smoking. And I think these are the two areas of complications regarding a facelift that are important. Now sometimes in a facelift we might do adjuvant treatments such as fat grafting, whatever. That may create some subcutaneous nodularities, and generally these will go ahead and heal, go away a month, 2 months, 3 months, and in the end don't really affect the final outcome.